I am from section number 38533, and I'm going to be doing my central line dressing change skill. And so the first thing I would do is I would check my order, make sure I have an order, and I would wash my hands. I would introduce myself to my patient and explain the procedure. I would check the chart and ask the patient for any allergies, especially to tape or the antiseptic. And that being said, then I would put masks on both myself and the patient. If there wasn't gloves available, I would ask the patient to turn away from the site. My mask would normally be in my kit, so I would open it just enough to get my mask out.
Hi, this is Vanessa Johnson in section 38350 performing a dressing change.
Then I'm going to look at the site and check for any signs and symptoms of infection, redness, swelling, inflammation before I start. Then I'm gonna use hand sanitizer or wash my hands. I'm gonna put on clean gloves. I would make sure when I identify my patient that I have them repeat their full date of birth and full name and check their wristband. And so now that I have my clean gloves on, I'm going to remove the old dressing, and I would start down at the bottom where it's not so tight against the skin. Work my way towards the center to avoid pulling on the line. Make sure the patient's tolerating well. And then I'm going to remove the dressing and the old bio patch towards the line. And then I'm going to throw that in the trash. And then what I'm going to do is I'm going to inspect that site again and check for any signs and symptoms of infection, redness, swelling, inflammation, check and see how the patient's tolerating. So, and then I'm going to remove my gloves. Wash my hands again. And I'm going to prepare my sterile field. I'm going to take my drape, lie it here. I'm going to remove my sterile gloves. I'm going to open up my new bio patch sterilely and drop it into my sterile field, as well as my new positive pressure cap, which is already in there. And then I'm going to get my flushes ready. And I'm going to make sure to remove the air bubble, pull back, get rid of that air bubble. Then I'm going to put on my sterile gloves.
I'm also going to have 3 of these will be placed on my sterile field.
Next, I'm going to take my cleanser and I'm going to squeeze the wings and press on my hand until it comes through. And then I am going to scrub vigorously the site for 30 seconds. Including the top. And underneath. Being careful not to pull on that line. 30 seconds. And then it would be okay to put these on the drape at that time. When I'm done letting it air dry, then I would put on my new bio patch with the blue side facing the sky. Then I would put on my
Make sure it is for a full 30 seconds. And I'm going to allow that to dry.
new clear dressing. Make sure you get all the air bubbles out. As I pull, I'm going to make sure it seals against the skin.
The opening is going with the line, and now the blue part is facing.
Make sure the patient is tolerating well.
Alright, see you later then. You sure you got this?
Then I'm going to go ahead and I'm going to open up my alcohol swabs, and I would clean the outsides of the lumens. I don't know if it's called lumen, the tubes. Clean those really well. And then I'm going to use an alcohol swab, and for each of the lines I am going to remove the positive pressure valve and scrub for at least 15 seconds.
Okay.
And then I would put on the new positive pressure valve, take my flush, I also should have mentioned that when taking off the valves, I would make sure that this was clamped, that the clamp was clamped to prevent blood from draining out. And so now that I'm going to flush, I would open it up. And then I'm going to push in slowly 2 to 3 cc's. And then I'm going to pull back to check the blood return. And then I'm going to use the push and pause method to complete my flush. Then I'm going to clamp. And I'm going to remove my gloves, remove masks, and I am going to label the central line, the new dressing, with my initials, the date and the time. Make sure to put the label where it's not covering the site. And finally, I am going to make sure my patient is safe, bed is down, side rails are up, comfortable, patient is comfortable, doesn't need anything else. And then I'm going to go out and I'm going to document my what I did. I'm going to document how the site looked. I'm going to document how much fluid I flushed with. I'm going to document the blood return, whether it was brisk, sluggish, or if there wasn't any, and how the patient tolerated the procedure.
3 milliliters.
And that's it.
Pull back.